The truth about PRP, especially with chronic hip pain, that a lot of people don't understand is that the PRP itself isn't going to solve the hip pain and prevent it from coming back in and of itself. What do I even mean by that? PRP can be really helpful for tissue healing. However, when we're dealing with something like chronic hip pain, especially if you're active, the issue with the pain isn't usually just the tissue itself. We have to look at the movement patterns, the pelvic floor, even just the nervous system. What is going on? What are the compensations? What else is causing the actual tissue changes to occur? And why aren't they getting better with typical rest or strengthening or rehab? If your pain comes and goes, or it increases or changes with stress, if maybe you feel strong, but that's not translating over into reduction in pain, then this is telling us that there's more than just tissue healing or inflammation that we need to be addressing here. We have to look deeper. We have to look at how all of these systems work together in order for us to calm the irritation down and actually rebuild the foundation so that the hip no longer has that root trigger that's feeding into it and causing the pain in the first place. We see this a lot with tendinopathies, labral tears, hip impingement. All of those things often have a movement coordination limitation present that's feeding into the tissues, keeping the pain, and then allowing the brain to just get used to that state. PRP does not address any of these factors. So even if you do the PRP, it needs to be in addition with addressing these other influences so that we make sure we're looking at and treating the full picture. And that is what helps reduce the flare-ups, the setbacks, or keeping you stuck in that chronic pain cycle.